everybody. I'm Dr. Michael Abruzzese. That's a very long name, so most folks call me Dr. Mike or Dr. A. Makes it a lot shorter. And I'm glad you're here on Dr. Mike's Psychology channel and also TotalSchoolSuccess.com. I'm going to be speaking today about something called childhood behavioral disorders. Now, it's a fancy term for what used to be called misbehavior or maybe some kind of difficult behavior. I'm going to talk about a constellation of behaviors that clinicians like to call symptoms or symptomatology, and I'm going to explain to you how they interfere with children's behavior and also children's ability to learn. I'm going to be talking today about attention deficit disorder, but you may find that attention deficit disorder, as I explained it to you today, is really kind of different from what you've been reading about or hearing about. You know, it's kind of interesting. When I started years and years ago, back in the 70s, it was really hard to convince people, especially physicians, pediatricians, that ADHD existed. In the beginning, way back going to 1903, I believe it was a cardiologist who discovered that some of his patients who had undergone heart attacks, when they recovered, they appeared to be recovered fully, but they had some cognitive deficits. They had trouble paying attention, they had trouble remembering things, they had trouble sometimes with controlling their behavior, they were very distractible. Well, he couldn't figure out what it was, but what he called it was brain damage. Must be brain damage. What else could it be? They experienced brain damage. We know now that they suffered a loss of oxygen to the brain for a few minutes, and that did cause some minor damage. Sometimes, of course, if you lose oxygen to the brain too long, that's it, game over. But these people would just lose oxygen to the brain for small periods of time and would have certain kind of deficits. Sometimes they would only show up when the adult survivors of heart attacks went back to work. For example, someone who was a bank president who had a heart attack, they would go back to being a bank president back in the early 1900s, and they couldn't really do the job of being a bank president. They couldn't do what we now call higher order executive functions because they had deficits in their ability to pay attention and to have a good memory. Well, no one really liked the term brain damage, so he decided, well, you know, this is not really brain damage like sometimes we see with a full head injury. Well, this must be a small brain damage. So we called it minimal brain damage. From that, it evolved into minimal brain dysfunction because they figured maybe it wasn't really damage, but some parts of the brain just weren't functioning as well as they were before the heart attack. And that evolved into something called MBD, minimal brain dysfunction. Well, fast forward about 70 years or so, and then sometime in the mid-70s, people changed from calling it minimal brain dysfunction to attention deficit disorder, or they call it ADD or ADDH. Well, fast forward again, another 20 years, and now we're calling it something different. We've kind of settled on calling it ADHD with or primarily hyperactive disorder, primarily inattentive disorder, or combined. We'll be calling it something else in a few years, but that was the genesis of how the condition that we now call ADD was discovered or how it was labeled. So anyhow, back in the 70s, it was really difficult to convince people that children had some of these conditions, had difficulty with the attention, the memory, and it was a constellation of symptomatology that we called ADD or ADHD. Now, I'm recording this in 2014, now it seems like everyone has ADHD. Now I've got to convince pediatricians and physicians and schools that not all these people have ADD. They have some of the symptomatology, but they don't have the full-blown condition. So yes, ADD is wrongly diagnosed. It's always been wrongly diagnosed. Some people call that a misdiagnosis, some people call it an overdiagnosis. Basically, what it is the fact that a lot of the people who are making the call and diagnosing ADHD, they're missing the boat. They're not getting it right. And here's why they're not getting it right, because ADD or ADHD looks just like a lot of copycat conditions. Copycat condition could be, for example, if you're overtired. If you're overtired, you can't pay attention very well. If you have the cold or a flu, can't pay attention very well. If you're frightened, if you're extremely anxious, if you're panicky, if you have test anxiety, can't concentrate very well. And if you have any kinds of condition like maybe a depression, post-traumatic stress disorder, or a learning disability, sometimes you can't concentrate very well. None of these things indicate that you have ADHD. They don't mean you have ADHD. However, some other kinds of copycat conditions mimic the signs to a greater or lesser extent of ADHD, but still you don't have ADHD. Now, why is this important? Well, from a behavioral point of view, if you're going to treat someone behaviorally, which means without medication, it doesn't make a lot of difference because you treat all these copycat conditions in a very similar kind of way. But if you're prescribing medication, it has huge implications because, remember this, no medication works 100% of the time for everyone. No medication. It doesn't. If you're looking for a 100% cure, either with behavioral treatment or with medication treatment, you're going to be disappointed because there is nothing that is 100%, 100% of the time. But in the condition of ADHD, if you're prescribed some of the medication for ADHD and you don't have ADHD but you have a copycat condition, you can make that copycat condition worse. You could also have a very bad reaction to the medication you're taking for ADHD. And that could be so adverse to the family and to the child, they're not going to try any of the kind of medications anymore, and that could be very bad for them. So typically, in my experience, the right medication for ADHD, when it's warranted, and it is not always warranted, but when it is warranted, it works about 60 or 70% of the time when you have the right medication. Now, there's a whole bunch of different medications. Before, we only had a couple. Now we have probably maybe 10 or 12, and new medications are coming out almost every other year, it seems, because the pharmaceutical companies, well, they think they have a better product. In reality, the research doesn't indicate they've got a better product. But in any case, before you decide on medication, you have to decide if the medication is correct and if it's for you, if it's going to be helpful. There's a risk and reward that you have to consider. There's always a risk of taking any kind of medication. You have to consider, do the rewards of taking the medication, if it works, outweigh the risks. But before we get to medication, let's talk about the behavioral condition called ADHD. Now, as probably everybody knows by now, ADHD is a condition that means you have trouble paying attention, right? Well, no. No, that is not what the attention deficit disorder is. You think that's probably what it should mean, right? Attention deficit disorder, it means trouble paying attention, but it's much more than that. Now, ADHD or ADD, whatever you want to call it, is marked not by just difficulty paying attention. It also involves persistence difficulties. It involves what we call, in my field, changing sets or transitions. It involves focusing and sustaining. It involves other symptomatology too, which I'll talk about a bit later. If you want to meet the official criteria that physicians and psychologists usually adhere to when diagnosing ADHD, but it's in my experience, unfortunately, hardly anyone ever follows those. They take a couple of things and they decide, okay, this kid has got ADHD. Now they're saying, okay, this adult has ADHD. That's really not how you're supposed to do it. But let's assume now that a person does have ADHD. Okay, they have signs of attention deficit. They really do. Let's say they do meet the criteria of attention deficit hyperactivity disorder. Okay, well, certainly then that's it, right? Game over. Okay, get some medication on board and we're good to go, right? No, 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 that is wrong. Just because a person has ADHD, and let me just say that if you have ADHD, you have it. You don't have a mild case, you don't have a major case, you don't have a little ADHD or a lot, you have it. It's like a light switch. Either you have it or you don't. The lights are on or the lights are off. Either you have ADHD or you don't. Now, about ADHD, when people have ADHD, and it's diagnosed when they're a little kid, you know, they have about this much ADHD, just about this much, because they're little kids, right? And you're born with ADHD. It's a developmental disorder. You are born with ADHD. You can't get ADHD because you're in a car accident, your head has gone through the windshield. That is a different diagnosis. But you may have many of the symptoms of ADHD, but that That's not the point. The point is you have a head injury. The result of a closed or an open head injury is a lot of problems, many of which involve attention and memory. But properly speaking, ADHD is something you're born with. But when you're born, let's say you're a little kid, right? And let's say you're a little kid. Well, this kid is pretty little. And look at this. This is how much ADHD they have. That's a lot of ADHD. A lot of difficulty for the child when they're 2 years old, being able to overcome that. Properly, you should not diagnose anyone, well, you shouldn't erroneously diagnose anyone at any time, but mistakes happen. But you should understand that you couldn't really be diagnosed with ADHD under the age of 3. That was the criteria for a very long time. But when you're a 2 or 3 year old and you have attentional difficulties, they can seem insurmountable. But as you get older, you may notice in this diagram, the ADHD doesn't change. The ADHD does not grow with you. Your bones grow, your brain grows, your abilities grow. ADHD does not grow. It stays the same. So when you get to be an adult or a teenager, guess what? Your ADD, your difficulty, stays the same. That's why many people for many years were thought to have outgrown ADHD. It's true, you do. But more properly speaking, you just learn to cope with it better. You learn to zig and zag. You learn to outfox the difficulty that the ADD symptomatology presents to you. You learn to overcome it. It's an obstacle that you overcome. Like many other obstacles we have to overcome, you learn to overcome the obstacle of ADHD. Now, of all the major different subtypes of ADHD, and there are at least 4, of all the major subtypes, medication really only helps one. It tends to only help with the hyperactive, the kids that are so-called bouncing off the walls, can't stay in their seat, can't stop themselves from moving. Medication seems to be more helpful with that. So I talked about ADHD, attention deficit hyperactivity disorder. Well, as you may not know, many people don't have any signs of motoric hyperactivity. They just don't have them. What happens then? Well, I guess they don't have ADHD. Well, I would disagree. I would say that the hyperactivity is not motoric, but the hyperactivity is cognitive. They cannot control their thoughts. Their thoughts are running around and racing, just like their bodies can run around and race when they're little kids and they have difficulty with motoric control. So just because someone may not have a physical kind of hyperactive, bouncing off the walls kind of behavior, does not mean they don't have ADHD or ADD. It simply means it's gone inside. It simply has gone inside, and they could have a tremendous amount of difficulty controlling and focusing their thoughts, sustaining their thoughts, and switching their thoughts, getting some control on them so they can pick up the toys when it's time to go to grandma's house, or they can close their book and go on to a different subject in school. Is a kid going to tell you this? How could they tell you? They're not going to know what's going on. Unless you know the questions to ask and the behaviors to look for, you're not going to know it either as a parent or as a clinician. But assuming you get past all of that, and the person does have ADHD, well, okay, we've taken into consideration that they haven't outgrown the ADHD. We've taken into consideration that they may have motoric hyperactivity or they may not have motoric hyperactivity. Again, done deal, right? Let's get the medication ready. Well, not so fast. Not so fast. Anyone who has ADHD really has more than that. In all the years I've been working, and I know a lot of my colleagues will disagree with this, I've never seen anyone who has ADHD who did not also have a condition known as oppositional defiant disorder. Does that ring a bell with anyone? Kids who are oppositional? Anyone ever have any dealings with someone like that? Any grandparents? Any parents? Any teachers? What is oppositional defiant disorder? Well, it's not as scary sounding as it is. It's difficult to treat, but it's not all that scary sounding. What it really means is the child or the adult does the opposite of what they're told. You say up, they say down. Well, you say white, they say black. You say stop, they say go. And you think, what's wrong with it? This doesn't make any sense. And you're right, it doesn't make any sense. Oppositional defiant disorder, ODD, is a very difficult behavior to treat. It's just as difficult for the individual who has it, child or adult, as it is for the individual trying to deal with them, like a parent or a teacher, a grandparent, even a brother or a sister, or certainly an employer, colleague, coworker. It's very difficult to treat. It can be treated behaviorally. I'm not aware of any medication that treats ODD except if you just totally snow the person, that's what medications can do. They can totally knock someone out. Well, they're not going to be oppositional then, are they? But that's not the point. The point is, how can a person function with oppositionality? So a person who has ADHD, I'm telling you, is also going to have oppositional defiant disorder. And I've seen some reports come through from people who say, well, this person clearly has a strong case of ODD, but they don't have ADHD. Well, I don't believe it. I simply don't believe it. Now, I know there are some colleagues who would disagree with me, but I'm telling parents and the people who are listening that if you have a child or a teenager or an adult who's been diagnosed with ADHD, they have ODD. Do I care if you believe me or not? Not necessarily, but I'll tell you one thing. The individual who has ADHD, they had better take a look at this ODD thing, because that is really what's messing up their lives, more than just the ADHD. Now, you may think, okay, I believe you. They have ADHD, they have ODD, that's it, right? Nope, unfortunately not. Because again, if you have ADHD, you have ODD, you also have a condition called conduct disorder. Conduct disorder travels along with ADHD. Now, in truth, not everyone who has ADHD has conduct disorder. No, they do not. They do not. Don't think that for 1 second. If you have ADHD, I'll bet you dimes to dollars you do have oppositional defiant disorder, but no. Conduct disorder, no. You may have a couple of features of conduct disorder, but they're not difficult. They can go away. They're not a big deal. Conduct disorder used to be called, in the old days, juvenile delinquency. Delinquent disorder. The kind of kids who used to wind up in jail, who used to wind up in jail as adults, the kids who grew up to be really bad kids and bad adults and did bad things. If you have ADHD, some of the research says, this is not good. You're going to wind up at risk for taking drugs, at risk for going in jail. You are going to be headed down a bad road, young person. No. If you have ADHD and conduct disorder, probably, yeah, you're going to have a really hard road. You're really going to have to overcome this. Again, there's no medication that treats conduct disorder. There is medication that could help with some of the features of ADHD, primarily the motoric hyperactivity. There's no medication that can treat conduct disorder or can treat oppositional defiant disorder. Well, you think now, I didn't realize that. So if my child has ADHD, then I can expect them to be oppositional? Yes. And I can expect them to have conduct disorder? No. Maybe some features, but the full-blown condition, rare. In some cases, yes, but rare. Okay, but that's got to be it, right? Not exactly. And here's why. It's because of a condition called Tourette syndrome. Now, if you have, this is supposed to be a triangle up here, here you go. If you have Tourette syndrome, TD, if you have Tourette syndrome, most people know Tourette syndrome as being like a ticking disorder. They have a twitch. If you haven't got a twitch, I guess you don't have Tourette syndrome, correct? Again, no. Most people are misdiagnosed with Tourette syndrome because if the physician doesn't see it in the office, they don't see the twitching taking place in the office, like I just demonstrated, then they're not going to diagnose someone with Tourette syndrome. That's a big mistake because people can inhibit their tics. Anxiety can sometimes help a person to inhibit their tics. They're so anxious, they don't tic. Anxiety also, in some people, makes their tics worse. So if you have anxiety and Tourette syndrome, your tics might be worse when you have an anxiety issue, or they might not be. They might be better. How can you tell? It's individual for different people. It's never the same for the same person twice. So if you have Tourette's disorder, you have ticking. And the tics can either be guttural tics, someone clearing their throat. It could be a tic like that could be a tic. Repeated behavior in a certain kind of area, that could be a tic. Could be eye blinks. Could be twitching, the dramatic kind of motoric twitching that I showed you before and I just showed you again. It could be that. But Tourette's syndrome, Tourette's disorder really has to be taken into consideration whenever you're considering ADHD, and here's why. Because if you don't, and you only see the ADD symptoms, which are part and parcel of Tourette's disorder, and you prescribe medication for that, let's say Ritalin, the old medication that people used to prescribe a lot, and you have tics, the Ritalin will exacerbate the tics. They'll make the tics worse. So if the tics were very subtle and hardly noticeable before, and you get the wrong prescription, you get a prescription for ADHD, like Ritalin, instead of something else for Tourette's syndrome, the tics will just blossom. They will just explode. You'll have such a bad reaction, you will have the tics. And there seems to be an open question in the research. The old research said that the tics do not go away once you stop the medication. Some of the other research, later research indicates, if you stop the medication fast enough, then the tics go away and things go back to normal. Well, if you have Tourette's disorder, again, it's a lifelong condition. So it's an open question about the research that the early researchers did. Maybe they just didn't realize that tics aren't going away, and maybe the medication had nothing to do with it. Maybe it made them a little more pronounced, but they were always there and they just weren't noticed. Now you're thinking, okay, so I've got to make sure if someone I know has this kind of thing that I think might be ADHD, they have to be evaluated to make sure they don't have Tourette's. Is that correct? Yes, please, that is correct. It is definitely correct. It is definitely correct before you consider any kind of medication. If you have Tourette's syndrome, you have ADHD. If you have ADHD, what do you have? You also have oppositional defiant disorder. You may have some features, a couple of little touches of conduct disorder, or you may have a full-blown condition called conduct disorder. May, emphasis on may. But don't put that on your head. I don't want you to think about that. You will have ODD, maybe, possibly some people might have some features of conduct disorder. But again, that must be it, right? Nope. Because if you have Tourette's syndrome, which is a repetitive ticking condition, you also have obsessive compulsive disorder. You have an obsessive compulsive disorder. Now, you can also have obsessive compulsive disorder as part of an anxiety disorder. Anxiety disorders, there's a number of anxiety disorders, one of which is obsessive compulsive disorder. But if you have a repetitive ticking condition, you also have OCD. You have features of OCD, or you could have a full-blown condition of OCD. There is some question in the literature as to whether it is the same as an anxiety disorder, OCD, or if it's a separate condition as just a part of Tourette's disorder. But if you have Tourette's disorder, you have features or a full-blown condition of obsessive compulsive disorder. These folks travel together, these folks travel together, these folks travel together. So if you have ADHD, it's conceivable that you could have OCD, you might have Tourette's disorder, you're going to have ODD, possibly could have some features of conduct disorder. But if you have Tourette's disorder, you have all of these, possibly some features of conduct disorder, definitely ADHD and ODD and obsessive compulsive disorder. If you're considering medication, this is really important to understand and make sure that your diagnostician considers all of these things. Because otherwise, the medication can backfire on you and you can have a lot of difficulty. Now, in the next segment, I'm going to talk about how we treat these behaviorally. But understand, if you have ADHD, you have to evaluate for Tourette's syndrome, look for obsessive compulsive disorder features, expect to have ODD, which there's no medication that could treat. You may have features, or your child or loved one or teenager may have conduct disorder. These are important considerations to have.